So basically what we show the patient is we want to make sure that they know what plaque is. So we show them this photo, and on this picture it shows above the gums how they're red and puffy, and that fuzzy white sticky stuff is plaque. It turns kind of yellow. Sometimes the gums get really puffy and swollen, and if we brush those, they would start to bleed. So what we want the patient to know is that when your gums bleed, you don't actually avoid that area, but you pay more attention to that spot. Requires more brushing, more flossing. So we show them what it can look like around the braces, and this is the same patient with the braces off. It shows some decalcification, which is the white staining, and those are shallow cavities, and here they went a little bit deeper. So we want the patient to know that taking care of their teeth with the braces on is very important as how they're going to look when the braces come off. We would love for their teeth to look like this, because what we want them to know is their smile is going to look fabulous when their braces come off. But if they haven't been taking care of their braces and their gums, there could be staining. So we want their teeth to look nice and straight, but also gums healthy. So what we show them is on a model here. So we actually give them a Sonicare toothbrush because Dr. Larson feels that it actually helps keep their teeth a lot cleaner. So we show them how to use it. We turn it on. We show them also how to angle, because they're used to brushing this way, just right on the tooth surface, but what we want them to know is to turn it above, and they're going to get on the gums and they're going to hold it there and let it massage, and then they'll slowly move to the next tooth. So it's not about quickly brushing, but taking the time and getting in the right spots. So angling the toothbrush is very important around the gums, but also below. Below will help get the toothbrush up and in between also. The other surfaces of the teeth will remain the same. You can still brush like this on the inside. Okay? So that is very important. Dr. Larson recommends them to brush their top teeth for 2 minutes and the bottom teeth for 2 minutes, and that will help them get all the right angles. And then we go over flossing. Flossing takes a little bit more time with braces, but it is just as important. What you're going to do is take a floss with a threader. It's a hard plastic end, and it guides the floss underneath the wire. So they go under the wire, and it will go up in between, and they'll massage the gums, and then they pull it back through. And they have to thread it one tooth at a time. So it does take longer. On the back braces, there's hooks, and sometimes the floss gets caught. So we just tell them to be patient, you know, maybe grab another piece of floss if you need to, just make sure to get the back ones also. So that's flossing. Floss also comes separate, where you have to buy a threader and a piece of floss and join it together. This one is already combined. So we also provide them with a little scrubbing brush. It's interproximal. They can use it if they have big gaps between their teeth. They can squeeze it in between, or they can use it up underneath the wire and get the sides of the bracket. Say after they brush, there's still a couple areas that have maybe that fuzzy plaque on there. They can squeeze that in there nice and tight and clean that off.
Perfect. Thank you.